Mental health care for incarcerated people. Proper mental services for incarcerated people could in turn help the common person. Let's now get into how this makes sense and why you should care, even for your own personal gain. Overall, prison mental health care is proven to lower crime and provides for more eligible and more competent working class individuals post-incarceration, making the world a safer and more lucrative place to be. I invite you to think for a second. Let's talk therapy. Close your eyes. What comes to mind when you're thinking about typical clinician and client settings? If you haven't been in one of these settings firsthand, try and think about what you imagine one looking like. What do you see? What do you hear? How do you feel? Maybe you pictured something like this: a comfortable chair, some plants, a welcoming and understanding clinician, and maybe a private closed-off room to speak your thoughts. Remember this comfort as I now invite you to think about prison conditions and how these comforting settings cease to exist. The reality of prison looks something like this: isolation, desolate conditions, and most of all, feelings of hopelessness with such limited access to mental health care. If existing at all, mental resources are so limited in prisons and do not involve these soundproof offices, inviting clinicians, and there are probably no plants. In prison, people often feel like outcasts, dehumanized, and shut out from society. These feelings were commonly reported when focus group research was done with incarcerated people. These findings are not shocking since prisons are almost designed for these negative outcomes. Studies have shown that in women's carceral settings, they express severe concerns for their mental state on evaluation forms and are never given treatment for these expressed concerns. Imagine a loved one was suffering from a mental illness while imprisoned or one onset during their sentence. Hopelessness, fear, pain are all feelings of these incarcerated people and their families while these problems continue. According to this infographic, the Prison Policy Institute states that data shows incarcerated people disproportionately suffer from mental illness. Overall, incarceration in America is an issue. This is a complex topic that poses with a lot of layers. In these settings, people are at their lowest point and statistically have mental issues, either undiagnosed or ones that develop while incarcerated. Specifically, women report while incarcerated that their mental concerns are blatantly ignored. These ignorances are deeply internalized and cause deeper mental issues in these women. These injustices include high copays forced upon these women who do not have the ideal financial means in these settings, and reported on having to suppress their health conditions to be eligible for work. At its core, incarceration has a root purpose of rehabilitating people and getting them to a point of being able to reform and re-enter the world as a contributing member of society. This is truly difficult to obtain without addressing mental conditions while incarcerated and having various resources to resolve these during incarceration. Some may argue that non-incarcerated people's tax dollars should not have to be spent on increased psychological services for incarcerated people. Although many may be doubtful, this can benefit all people, outside of prison walls as well. Diligent working members of society can emerge from mental treatment in prisons and allow crime rates to decrease when symptoms of mental disorders are at bay due to real therapy and aid in prisons. We are all pieces to the puzzle. In order for all of us to succeed, incarceration needs to be more rehabilitative and truly emerge people who are in control of their minds. At the end of the day, everyone is someone in society and contributes to the dynamic of the world. When more people are at a strong mental functioning, life is easier to manage for everyone and anyone you may come in contact with. Diligent working members of society can emerge from mental treatment in prisons, and it is proven to deter recidivism if properly implemented in these settings. Let's work together to end the stigma with mental health. This truly starts in prisons.